All right, people, so we're back, and we are just about 12 minutes away from the hour of 8 o'clock, and of course we are joined by Seth Viola aboard here. So Seth, good morning to you.
Good.
And what we talking about this morning? You said
PCOS and PMOS.
Or PCOS.
And PMOS.
What is that?
Right, so PCOS, which is polycystic ovary syndrome. And PMOS is what they are rebranding it or reframing it as.
Okay.
Which has to do with Polyendocrine Metabolic Ovarian Syndrome.
Okay, no problem.
Right? So,
Yep.
Good morning, Trinidad and Tobago, all of our viewers internationally and regionally. All right, so this segment is more for the ladies, the females, because these issues affect women. All right, most people know about PCOS, right? Polycystic ovary syndrome, and that has to do with having cysts and stuff on the ovaries, or that's what most people thought. And this is why they are reframing it and rebranding it, because the old definition or the old wording or description of it would kind of make people misunderstand all the factors around it. So if somebody don't really have cysts, then they might think, well, I don't have this condition. Or if their ovaries looking fairly normal, but they have other issues, they'll think, well, I don't have this condition. All right? So what we're going to do, we're going to pull up on the first diagram to understand what are the two. So we have the PCOS or the PMOS and why the name change. As we see, polycystic ovary syndrome is the older term. And as I mentioned just now, it sounds only like dealing with the ovaries and cysts. But we need to see the bigger picture. It's not just the ovaries. As PMOS, which is Polyendocrine Metabolic Ovarian Syndrome. The newer term, the broader name, and it includes hormones and metabolism, because the issue does affect much more than just cysts and the ovaries. It's an issue that affects, when you think about hormones, hormones would affect how your entire body function. It affects androgens. It would affect things like acne. It would affect irregular periods, menstrual cycle. It affects fertility. It affects the metabolism, all of these things. And of course, metabolism would also affect your nutritional health. So it affects a lot more. And this is why they decided to reframe it and rebrand it. So let's now go to the next diagram to make some comparisons here. And let's see. I'll go into it a little bit more. So when your hormones are affected, hormones regulate a lot of things in the body.
Right.
You would see people having issues with, let's say, weight. They're gaining weight.
Okay.
You could fall under the bracket of PMOS, right? Because weight gain is an issue. You have issues with your ovaries, yes. So you might be developing cysts on your ovaries, of course. And then we have androgens. So androgens has to do with hormonal imbalances. And this can lead to things like acne, and even things like facial hair and all that some women would be having. But because the first name is just on polycystic ovaries, they're thinking, I don't fall into this category. All right? But that's why it needs to be reframed, rebranded. All right? So it affects multiple systems. Systems. Of course, I have been dealing with this condition at my clinic and have been reversing these conditions at my clinic for the longest while, because I deal with root cause. So while some might say, well, the name doesn't make a difference, it makes some difference, because it could help people to understand that they do have a condition, all right? But at the end of the day, you still have to deal with what is causing the condition. You have to go a little bit deeper than just looking at the symptoms. So in the third slide, which we're going to bring up here, in this diagram here, we are going to see the differences in which how people deal and address with these things. A lot of people go with stuff from a symptomatic approach. They want to regulate or suppress the symptoms. For example, a woman may be suffering with irregular periods, so then they're going and try to treat that. They might treat that through medications. Somebody might be dealing with acne, so you'll see them buying the stuff for the face, for facial washes and all of these things.
Right.
Some might be having the facial hair, so they might turn to shaving or laser treatment and these stuff. Or you might have the weight gain where they might push more exercise and then weight reduction diet. And there's a reason why I say weight reduction diet, because you can have a diet to lose weight, but that doesn't necessarily mean the diet is a diet that is improving health per se, because not all weight loss is healthy. These are things that most people are not aware of. And then you have infertility, so then they might be taking medications and stuff to try to address fertility. But we have to go more at the root cause focus, all right? Have to look at things like insulin and metabolism, right? These factors encompasses a lot more. So insulin and metabolism, that is going to affect which metabolic system the body is on. And if the body is on the wrong metabolic system, that could cause a whole branching off of other issues leading up to these things. Metabolism would also affect your hormonal balance, because there are things that I've mentioned when people come to me, for anybody that have done consultations with me with regards to this particular issue, PCOS, which is now PMOS, I would always mention something about SHBG, which stands for sex hormone binding globulin. That's why I say it's good to people to come and see me, because sometimes, you know, you're going through the scientific terminologies, it might lose people.
Yeah, because I lost there already. I mean, you're not lost me there, though.
All right. So these are things that I address, even though they come with us with issues like they have a cyst or fibroids or any of these other fertility issues that women would be dealing with. You cannot just address it from the symptom alone. All right. Not saying that people don't want relief, or the symptom alone approach has a benefit for some, but it's not going to fix the issue.
Right.
It's just going to give a temporary relief. And that is not the approach that you want to take. You have to deal with things like what called inflammation and stress. And as stress is mentioned there, we need to understand what stress is as well. A lot of people think of stress as just being something mental. And that's an area that I think people are flawed on. A stress is any physiological load that is placed on a physiological system, all right, that causes a strain on it. So let's think about, if you are not eating right, isn't that going to place a load on your system?
Yes.
So a poor diet is stressful on the body.
Yes.
What people think or register as stress, they think is some kind of mental state. But what is a mental state? Isn't that the release of hormones and stuff, whether it's in the brain or serotonin and all of these different stuff? All of that are physical things. So we have to address those physical attributes, those physical qualities, those physical mechanisms when you have to deal and address stress. And then we have the infertility. So infertility is a big issue. It's a big issue. But you have to deal with these things from the root cause. And the root cause need to always take the nutritional approach. Because if you eat bad, remember, what you consume is how your body gets all the raw material to build everything. So to your hormones, you need to eat to get the nutrients for your body to produce hormones. You need to eat to get the nutrients for your body to produce insulin, right? All of these things has a nutritional foundation, every aspect of the body. If you're an adult and you still have acne, it means your system is off, right?
Yeah, that's true. Acne is a teenage.
Exactly, right? But if you're an adult and you have acne, you have hormonal imbalances.
Right.
That is not just something you have to, you ain't washing your face enough, you need to get these special creams to wash. No, that is not it.
So the facial hair aspect of it, that's for females?
That's also for females, yes.
Right.
So it have females who are hormonally imbalanced, and that causes them to grow facial hairs. But these are things that are happening to the body because there are imbalances. Now,
just on the inflammation aspect, because you touched on the stress, right?
Yeah.
Inflammation comes in many different forms, right?
Well, based on where it manifests.
Right, yeah.
It could have different manifestations and different symptoms. Right? So, but inflammation what is one of the main culprits behind inflammation? Because inflammation is like an immune response. So last week we talked about something called glycation, right? Which has to do with sugar bonding to stuff in your body without being regulated by an enzyme, non-enzymatic bonding of sugar, all right? And so when you are consuming the wrong foods, you're on a high sugar diet. You're consuming things you're not supposed to consume. You first have to be educated on what you're supposed to or not supposed to consume first. But you're consuming things that causes inflammation. That is going to throw off things in your body.
Okay.
All right? And most females, I think is what? 1 out of every 3 or 1 out of every 4 females have some sort of metabolic issue. I believe that has gone up now. It's probably almost 50% now. Right? But we are in a bad state because most people don't have the right education on nutrition. And that's where the problem is. All right? And we try to address issues simply from looking or going at it at a medication standpoint. So let's go to the final slide here, the diagram 4. All right? Nutrition comes first. Nutrition comes first. That's why nutrition matters. It is the foundation. All right? It is the foundation. So, and it affects the body, it affects the cycles. Because what you eat affects your metabolism. You could eat, if you eat incorrectly, the wrong metabolic system would activate because your body would always try to do the best that it can with what you give it. If you give it the wrong thing, it will have to switch up the system to try to make the best use out of it. But next week I have a program that I'll be coming with, but I want to show it from a locomotive perspective, all right? Or it's like burning coals or burning fire. But I'll go into metabolism a little bit more next week. But the metabolism is where your body is breaking down what you consume to then provide you with the nutrients that you need, and that is what is going to help your body to produce your hormones.
Okay.
So if you are not eating correctly, you could have underproduction or overproduction, or you have hormones that aren't being binded by things like SHBG, and then that would affect the reproductive functions of the body. So this is how females would develop these cysts and these fibroids and have irregular menstrual cycles and all of those issues, and that lead to the acne, and that would cause the facial hairs. Not everyone gets that, but different individuals, based on what is being consumed and how it's being consumed and genetics, it will affect them differently. And that is what causes the symptoms and the outcomes. And that's why I'm saying nutritional therapy is your and should always be your first resort and not your last resort. Make it your first resort. Nutrition is the most important aspect of your health because that is where you get in the raw material for your body to build, heal, repair, and produce the hormones and enzymes, literally everything that it needs to function. All right?
Okay.
And I am for the rebranding of PCOS to PMOS, but I also want people to know that you could rebrand something, but if you don't change your approach towards it, if you don't focus on a root cause approach, you're going to still be spinning top in mud and you're taking different drugs and products and so forth. Because when it comes to nutrition, I'm not talking about going and do a detox, right? I'm not talking about going and juice and suck down some herbs and all these kind of things that people have been doing, all these home remedies, and they're still consuming the things that harm in their body, right? I mean, I might have to do a segment on detox. I think I talked about that before.
I think we did that, but maybe some years ago.
Yeah.
It was one of the earlier topics, I believe, because of the vaccine.
Yeah.
I think we had spoken about detox at some point in time in the early stages, indeed. But people, you could check out SET. If you want to get to the root cause of your problems, you could check him out and book your appointment today. Rebuild your health from the inside out naturally. Now, he doesn't deal with drugs or supplements or anything like that.
Root cause approach.
It's all nutritional therapy, and it's all about reversing your problems. All right, now, if you don't pay your light bill and TNTech cut you can't reverse that. You have to go get the money and pay your light bill, all right? So, but
That's the analyst.
But anything to do with your body, you know, diseases, things like that, from cancer to hypertension, digestive disorders, diabetes, cardiovascular diseases, and more, that is Seth Wile about. So you can give him a call on 2793935 or 7611952. And of course, he has the book, You Are Not Sick, You Are Malnourished. You could pick up this book at RIK bookstores nationwide. You could go to Amazon. You could also call him for the book. You could go to Nelson's in Tobago or Gumroad.
Yeah, for the digital.
Gumroad, eh?
Gumroad, yeah, Gumroad, yeah.
Road.
Yeah, road, yeah.
Road as in the road outside.
Yep.
Why I can't get that thing right up to now, boy? A whole week, boy? Eh? Right, so Gumroad. You could also go to Gumroad, get a digital copy, all right? With that, the numbers 2793935 and 7611952. And we're going to take the final break and come back with the birthdays. Don't go anywhere. We'll be back after this.
Are you tired of managing symptoms without understanding why your body is breaking down? Seth Wile's Holistic Health Clinic provides consultation and re-education sessions followed by nutritional therapy programs designed to address the root causes of chronic disease. The clinic works with clients in Trinidad and Tobago and internationally, helping people rebuild the body through correct nutrition, not drugs, supplements, herbs, detoxes, injections, or quick fixes. Seth Wile is also the author of You Are Not Sick, You Are Malnourished, a powerful health book that has been the top-selling book on consignment at RIK bookstores nationwide every month since entering the stores. If you're struggling with cancer, diabetes, high blood pressure, obesity, autoimmune issues, fertility challenges, digestive problems, or other chronic condition, book a consultation and re-education session today. Purchase the book at RIK bookstores nationwide, Nelson's bookstore in Tobago, Amazon, or Gumroad. Visit SethWileClinic.com or call or WhatsApp 2793935 or 7611952. Seth Wile's Holistic Health Clinic, rebuilding the body, reversing disease through nutritional therapy.